Hey guys, what's going on? So, I'm back at school as you all know, and today is Friday. I had my first clinical day on Wednesday, and right now we're doing maternity and nursing, so I was actually in labor and delivery. Yay me. So I really enjoyed the experience. I mean, if I didn't know that I wanted to be in labor and delivery, working in that field. Right now, my goal is to be a certified nurse midwife, and that might actually be changing because I think I might want to go further with it. But if I didn't know that that's what I wanted to do before, then definitely being on the labor and delivery floor and just being in the environment, it completely solidified it for me. Like that is what I want to do forever. I'm sure I can do it forever. Um, so about my patient. She was 39, did in vitro fertilization because she has fertility issues. And when I got on the floor, she had come in on the 4th. She had come in on the Monday. I'm not even going to use a date, but she had come in on the Monday and I was there the Wednesday. And she had been cervically induced. So they gave her Cervidil, which basically softens the cervix and it's administered over a 12-hour period. Um, she was having contractions every 2 minutes and she was dilated at 4 centimeters. And she had been 4 centimeters since at least the day before. Um, she had received the epidural. She didn't want it at first. She wanted to do everything, really natural. Um, Wanted a vaginal delivery, didn't want to take pain meds, but as she's been in labor for, 2 days and the pain got to be too much, so she had to do what she had to do. Um, Pardon me. She had a long history because when I had got on the floor, the nurse that I was shadowing actually told me, the history section usually she said what was there for my patient wasn't exactly the norm all the time. My patient she had a lot going on. She had GERDs, she had infertility issues as I mentioned, high anxiety issues. She had had an ovarian torsion in October, and that's basically because she had a benign cyst growing on her ovary, but it started to twist, and I can imagine that's pretty painful. So they cut that off. Um, Her BMI was actually really high. So that kind of didn't cause complications. It just made relieving her pain a bit more difficult. Pain management was a bit difficult with that. Um, she had a benign thyroid nodule. Sorry about that. And hypertension. And she also had a familial history of DVTs. So she was a lot to work with. Really nice woman though, very nice. Her and her husband, and her mom was there as well. Um, so when I went in, she was in a lot of pain. Pain 9 out of 10 on a scale of, 1 being no pain, 10 being the worst pain she ever experienced. And the nurse that was taking care of her was actually in the process of getting her pain medication. Problem was that day there was one physician's assistant on the floor. Usually there are three of them. So this one physician assistant to about, I think there was 3, 6, 9, 12, 15, let's say about 16 mothers on the floor that were, in labor. So she had a lot to do. So pain medication was kind of a slow process in getting the order and making sure she could relieve that. So in the meantime, what the nurse had done was reposition her onto her left side. Again, like I said, it was kind of difficult. And she wasn't getting much relief from that. So the most we could do really was, just provide her with as much emotional support as we could. Her husband was there, so, that was good, but she was really, really in pain. Um, Her first child, and she got pregnant through in vitro, IVF. Um, let's see. Oh, she was on heparin to, reduce clotting, especially since she had a history of DVT. Metoprolol for her hypertension. Colace to ease her to make sure that she eased her bowels because she was in bed for 2 days, 3 days definitely. Granted, she hadn't been eating anything because you're NPO, nothing by mouth, when you're in labor. She also had folic acid, ferrous sulfate, and she was on pitocin. Um, so she had been in labor for a while, and the baby boy, he was obviously trying to come out, moving down the birth canal and everything. But because she was only dilated at 4 centimeters, and for so long, it got to be a bit problematic. So when the physician finally did come, he was like, you know what, we have to do a C-section because she had been in that position for so long. The baby had been in that position for so long. And at that point, anything can happen. You want to be careful that the baby doesn't go into distress or anything to that effect. So she had a C-section scheduled, and I was actually able to watch that. So changed out of my nursing uniform, got into my scrubs and all that, and we took her to the operating room. Got dad ready, brought dad in so that he can be near her, as this was going on. And she was really nervous. So the physician and us as the nurse and me as the nursing student really tried to, console her and let her know, you're gonna be that she would receive anesthesia and she wouldn't feel anything. And her concern was, hearing what was going on, hearing the staple gun and, just hearing what was going on down there. So the doctor was letting her know, I'm not going to say anything too crazy, too outlandish, to wreck your nerves even more, basically. And so she she calmed down a little bit. She was still nervous. I don't blame her. Her first child, she wanted to do a vaginal birth. Here she is having to do a C-section out of nowhere. She had just had an operation in October, which actually made this section different than others. Normally they would cut horizontally on, low down on the intrauterine line. The doctor actually went vertically and just went through the same incision that she had had when she had the ovarian cyst removed. So that was interesting. Saw the vertical incision, not the horizontal one. It was still pretty, it was amazing. Like, it was really amazing. And the physician had 2 interns in there with him, 2 resident students. So they were with him doing the operation. He guided them, and they cut through the stitches from the previous operation and the layers of fat. Got to the baby, yada yada. So the role of the nurse in this whole thing was to really, provide emotional support to the patient and the family, administer pain meds as necessary, as much as she could, and tracing the fetal heart rate of the mother, the fetal heart rate of the baby, and the contractions of the mother before she actually was ready to deliver. So I learned all about tracing. That's done every 15 minutes. And it's just, like I said, watching the fetal heart rate in relation to the mommy's contractions. Um, During the C-section, there were actually 2 nurses in the room, along with the physician, the 2 interns, and the anesthesiologist. Um, so one nurse scrubbed in, and she was basically there to hand the physician instruments and whatever he needed, gauze, the scalpel, scissors, yada yada. And the nurse that I was shadowing, her role was basically to chart information. Um, I forgot what this is called, but before everything started, she was there and she verified the patient, the operation that was being done by the doctor, yada yada. Um, of course, supporting the mom and the family members, making sure that they had as much information as needed, making sure that they were, their anxiety was minimal, and trying to just keep them calm and comfortable. She charted what was going on, set up got ready for the babies once the baby was born at that hospital, actually. And I think this is pretty universal now. Um, right before the baby is delivered, they call a nurse down from pediatrics to come up and also prep for the baby. So once the baby comes out, that nurse would come in and, clean the baby up, check the umbilical cord, make sure vitals are okay, etc. My nurse, she checked the weight and the blood pressure of the baby, um, swaddled it, and brought him over to mom. Because the baby had been, descending down into the birth canal for so long, he had a cone head. So adorable. I hope his cone head does go down, because he was in that position for so long, Poor baby. But still very adorable. And he was healthy baby. He scored 9 out of 10 on the APGAR, and I believe they don't give a perfect score of 10. They always give 9. So he got 9 out of 9. His hands and feet were slightly cyanotic, which is normal, once they are first born. Um, After that, we went to the post anesthesia unit with mom and the baby. Um, the nurse in there gave the baby a complete bath and, gave him his eye drops. Um, the hospital I'm in, they're very pro skin to skin contact with, mommy and baby to help with breastfeeding and just to stimulate the relationship between mom and the baby. So as soon as he was done getting his bath, he went skin to skin with her, and she tried breastfeeding a little later. And my nurse was still just completing different charts and printing stuff out and things to that extent. And at that point, she was basically just there for whatever mom needed. And yeah, that was about it. So it was really a really amazing experience. Like, I loved it, and I know that's what I want to do, and I'm just trying to get as much as I can out of this experience as I can, because we're only on labor and delivery once. My instructor sends 3 students every week, and we're going to be doing maternity for 4 weeks. So I have a month to take everything in. The next 3 weeks I'm going to be in postpartum. So that should be, hopefully it's more interesting than they said it was last week. Because speaking to my classmates, they're like, it's pretty boring. Because, after mom gives birth, she really just wants to sleep and rest and, kind of relax. And they said, yeah, all their patients were pretty much knocked out. So they didn't have much to do. But, it's like a waiting game. In labor and delivery, you trace every 15 minutes and monitor the baby's heart rate and mom's contractions. Um, Otherwise, you're just waiting around until she's ready to deliver, until she's 10 centimeters dilated, which is when she's ready to vaginally deliver. Or in my case, they had to call a section. So that was a different story. But I really enjoyed it. If you guys have any questions at all, I'm always willing and always here to answer your questions. If you have any video ideas, let me know. Like I did say before, I'm probably going to be doing less videos. What you could do is check my Tumblr, NursingStudentNaomi, and I'm going to do a weekly journal on that, just as to, what occurred during the week at clinical, if anything interesting happened in my classes, things to that extent, to kind of keep you more updated, because it's easier for me to just type in a quick text post there than it is for me to do a whole video and render it, every week or every few days, whatever the case is. So yeah, hope you guys enjoyed this video. It was really interesting to me. So yeah, bye.